everyone! Welcome back to Knowledge Chronicle.
Imagine your own body attacking itself instead of protecting you. Sounds scary, right? This is exactly what happens in autoimmune diseases. Welcome to Knowledge Chronicle. Today, we'll explore how your immune system, which is supposed to defend you from infections, sometimes mistakes your own cells for enemies. We'll cover major autoimmune diseases like lupus, rheumatoid arthritis, and type 1 diabetes, their causes, symptoms, and prevention strategies. What are autoimmune diseases? Normally, your immune system identifies harmful invaders like viruses or bacteria and attacks them, while leaving your own cells unharmed. In autoimmune diseases, the immune system malfunctions, producing autoantibodies, proteins that mistakenly target your own tissues. Think of it like a security system that suddenly starts attacking the furniture and walls instead of intruders. The result? Chronic inflammation, tissue damage, and impaired function of organs. Examples of autoimmune diseases. First, lupus, also known as systemic lupus erythematosus. In lupus, autoantibodies attack multiple organs: skin, joints, kidneys, and even the heart. Common symptoms include fatigue, rashes, especially the butterfly-shaped rash on the face, joint pain, and kidney problems. For example, a young adult may feel extreme tiredness for weeks without obvious reason, which is often an early sign of lupus. Second, rheumatoid arthritis, or RA. Here, the immune system targets the synovial membranes of joints. This causes chronic inflammation, swelling, stiffness, and pain, often in the hands and feet. Unlike osteoarthritis, which is caused by wear and tear, RA can deform joints if untreated. Third, type 1 diabetes. The immune system attacks insulin-producing beta cells in the pancreas. Without insulin, blood sugar rises dangerously. Symptoms include frequent urination, excessive thirst, unexplained weight loss, and fatigue. Children and young adults are most commonly affected. Causes and risk factors. Autoimmune diseases arise from a combination of genetics, environment, and lifestyle. Genetics play a role, as certain genes increase susceptibility. For example, HLA genes influence immune responses. Infections, such as some viral or bacterial infections, may trigger autoimmunity in genetically predisposed people. Hormones are also a factor, since women are more prone, suggesting estrogen and other hormones play a role. Lifestyle factors like stress, poor diet, lack of sleep, and environmental toxins can aggravate autoimmune reactions. So, let's talk about how autoimmune diseases actually affect the body. Autoantibodies and immune cells, well, they start attacking your own tissues, which leads to inflammation, swelling, and tissue damage. Over time, this means your organs might not work as well as they should. For instance, in lupus, inflammation in the kidneys can eventually lead to kidney failure. In rheumatoid arthritis, joint damage can seriously limit mobility, and in type 1 diabetes, the lack of insulin impacts nearly every organ, raising the risks for heart, nerve, and eye problems. Now, moving on to diagnosis and treatments. Doctors usually diagnose autoimmune diseases using blood tests, looking for autoantibodies, imaging studies, and by analyzing symptoms. Treatment, honestly, doesn't usually cure the disease, but it helps manage symptoms and slow things down. Immunosuppressants are used to reduce the immune attack, while anti-inflammatory drugs help relieve pain and swelling. Sometimes, hormone replacement or insulin therapy is needed if specific organs are affected. And of course, lifestyle adjustments like eating a balanced diet, regular exercise, managing stress, and getting enough sleep can really support overall health and reduce flares. When it comes to prevention and practical tips, well, you can't really change your genes, but you can reduce some triggers. Try to maintain a healthy, anti-inflammatory diet that's rich in fruits, vegetables, and omega-3 fats. Managing stress is also important. Things like meditation, yoga, or just enjoying your hobbies can help. Make sure you get regular checkups, especially if autoimmune diseases run in your family. And don't forget to avoid infections by practicing good hygiene and keeping up to date with your vaccines. Autoimmune diseases, in a way, remind us that even our most powerful defense, the immune system, can sometimes go wrong. But understanding these conditions empowers us to spot symptoms early, manage our triggers, and protect our health. And hey, your one like, share, and subscribe will help us keep creating more valuable content for you.